What we're talking about today, third-party risk. What are the unique issues? And I'm sure they got plenty of them, but I want to know what is unique for healthcare CISOs.
Email phishing, ransomware attacks. People are worried about losing data. So any kind of an attack or disruption of service that could impact patient safety, certainly unique to the healthcare sector.
When I was in healthcare, a lot of my colleagues said, we care about PHI, and they're especially when it comes to third-party risk. That's what most people are focusing on, is the PHI. But healthcare is really three separate areas. It's the payers, the providers, and pharma. Patient data is great to focus on, but look at it from a risk perspective as a whole.
It's everyone's responsibility to protect that PHI data that Jon was talking about. So just because you've outsourced some function doesn't mean you've outsourced the risk necessarily, right? Because if you own that PHI and your third party exposes it, there's a data breach on their end, you're still going to be the one that everyone's looking at.
I'm not going to pick on any particular vendor by name. I learned never to mention a vendor by name on this video chat ever again. Brent Williams, if you're here.
No, that worked out great. Everyone loved that. Keep going.
I know. But, a lot of times, stuff would come across my desk. Hey, we got to review this vendor. And I call it 4 doctors and a great idea and no security.
With respect to the current pandemic, contact tracing is being leveraged globally. However, with respect to PII data, especially for healthcare patients data, what should be the best way forward?
I think, we're kind of slowly, personally, maybe giving away some of our freedoms for the good of the whole, which, we can have that argument one way or the other, but there's not a good answer. How do you do that? I mean, it's either balancing for the good or I want my privacy.
It goes back to really understanding what data are you sharing with them, who's got that sensitive data, and if there's any critical business processes that you're outsourcing, to me, that's going to drive how deep those questions go and how often you ask that.
First question I ask any vendor, do you have a dedicated security team and do you have a CISO? Because if they say no, then, it goes back to my whole 4 doctors and a good idea.
I was shocked when I came to Health-ISAC to learn some organizations either didn't have one or they just got their first one a few months ago. I was like, wow.
As a humanitarian, I'm concerned about the convergence of privacy, IoT devices, and human safety. I'm curious what the risk strategy is becoming in the eyes of the board and the CISO, and also from a RiskRecon perspective. What is the threat intel data? Are you collecting anything to kind of help solve some of that problem?
I'm a pessimist, and I think it's gotten worse. It gets worse every day. From my observation in the space now for over the past year, one of the neat things that I do see happening is amongst the medical device manufacturing community, a coordinated vulnerability disclosure process.
In my experience with boards in the past, I think they're definitely taking that stuff more seriously because as Errol said, they hear about it on the news. So boards aren't always the most educated, and as they shouldn't be.
We are ready to play the Department of Yes, and wow, let the doctors do cyber and the cyber engineers do patient care.
I think it's a great idea because my mother always wanted me to be a doctor.
As cyber professionals, we have this innate ability to do forensics and track down things going on, and medicine is really forensic. So, if it's bits and bytes or bones and blood vessels, same thing.
Publish everyone's DNA results in a public-facing, unprotected cloud service. No more secrets, he says. Everyone's DNA is open.
We never have to worry about breach notifications again. That'd be one thing.
I'll give a shout out to the law enforcement friends and say that it'll be easier to solve crimes with everybody in there.
Make everyone using your healthcare services microchip themselves.
We need some kind of standard identity to verify patients.
I'm going to go along the lines of the answer of why we microchip our dogs, so if they get lost, we know who they are, whose dogs they are.
There's 2 questions I very much want to get to, one from Dutch and one from Jon. What question aren't we asking enough, Jon?
I'll go from maybe the vendor standpoint. Do we really need this vendor? There's a lot of times we bring in a lot of vendors for things that we don't really need.
Where's the rest of my budget? We talked earlier, right? Do we have enough resources in healthcare to do cybersecurity effectively? So we need more budget. We need more resources.
Health Renfro asked this question, though heavy-handed, he knows this. Do you believe disabling email hyperlinks using group policy in a healthcare environment to reduce phishing risk? Errol.
The problem is, I think we've got to stop delivering emails that have crappy links in them. So stop delivering emails that are malicious. Stop putting it on the end user. They're going to click on the stuff anyway.
There's always something that's going to happen, whether it be internally to your security or with a third party who maybe has lax security. So how do we recover from that? So being able to speed that up and mitigate the impact that we have from these sort of events is probably a good way to go.
Mm-hmm.
Lots of great information that's being shared, best practices and other work groups, birds of a feather, all that kind of fun stuff. Get involved.
Healthcare you're not on your own trying to feel this out. Obviously, we talked about finance being further along, and there's other industries that are more mature in certain areas. So get involved, talk to your colleagues in different industries, share ideas. It's a very much a rising tide raises all ships.